Hi, I'm Colleen Brenner-Schmidt, President of UACT, and we're here to present our PowerPoint on the new health benefits changes for Conejo Valley Unified School District. Didn't we just do this? Yes, we did.
And this is Jake Anderson from the California Teachers Association. I work with UACT as well. So the background on why we're here again is we've been cut by the state and federal governments to the tune of about $25 million over the last few years. As a result, we've had to do layoffs, we've had to do furlough days, we've made cuts in healthcare, we've made cuts in programs. We've been doing a lot of cutting, and as a result, our budget has shrunk and our healthcare costs have not. Nationwide, the national trend is 11% inflation for healthcare, but for us in Conejo, it's about 5%. But keep in mind that a 5% increase for us in our healthcare costs is equal to $1 million. So over the last few years, we've seen a pretty steady increase of $1 million per year. Back in July of 2009, we made changes to the monthly contribution. Before, there were none, and we started with some back then, and to try to mitigate some of the shortfalls that we were having at that time. And at that time, I actually thought that we would be doing away with the contributions because we would reach $1 million surplus, and that didn't happen. So we contributed with the monthly contributions. Then in January of 2012, we increased copays, emergency room visit copays, prescriptions. We did some plan modifications. And then in March, we increased the monthly contribution again. So we've made changes 3 times in the last couple of years. This is a graph, and you can't see the years below, but down here, this is 07, 08, 08, 09, 2009, 10, 10, 11, 11, 12, and this current school year. The gray is the total cost of healthcare in the school district, and that includes dental, vision, healthcare, salaries for the people that run the healthcare program, different kinds of insurance, everything. The blue line is what the district contributes from the general fund. And so you can see in 07, 08 we ran a deficit, 08, 09 we ran a deficit, and in 09, 10 we added the employee contributions here because of this deficit. We had a great year that year because our claims were down, and as a result, that's why I was thinking, well, we're going to be fine because we picked up about $1 million here, and so we had a $2 million gap to cover. But reality set in 2010-11, and we started running a deficit again, and that's why we increased the contribution here in 11-12, but the deficit continued, and we're looking at another deficit in this current school year.
Also with this, please note that in 10, 11, 11, 12, and 12, 13, we had fewer employees covered, yet our healthcare costs have increased.
As our budget has shrunk over the last couple of years because of state budget cuts and our healthcare costs have increased, the portion of the budget that we're spending on healthcare has gone from 10.65 down here to currently 11.25%. And so every dollar that the district spends out of their budget, 11.25% goes to healthcare. And like Colleen was saying before, the number of employees that we have over the course of the last few years has decreased by about 300 people. And we probably will see further decreases as the state budget remains flat, and we see declining enrollment in our schools. And as the numbers of our employees have decreased, the amount of money that we're spending on healthcare per person has increased immensely. Back in 2007-08, we were at just under $12,000. Now we're over $15,000 per person on average. This is taking that total package of this amount and dividing it by the number of employees, and we get this $15,000 amount. We overlaid the number of employees with the total healthcare costs to illustrate how, as we are decreasing in numbers, our total cost has continued to increase. And you can see here, we've made some pretty big jumps over the last few years. This is the amount of money that all employees, this includes classified teachers, CVPPA, our counselors, the administration, all employees, how much money has been spent out of our pockets just for the monthly contribution. This isn't copays or deductibles, this is just the monthly contribution. You can see here, this is where we implemented it, and it flattened out because we had fewer employees this year. And then mid-year, remember in March of 2012, it jumped up. So we got a bump in the contributions because employees were contributing more. And in this year, this is what's anticipated. That's a full year of the increase that we implemented last March.
So here you see what we are proposing to take effect as of July 1st. Basically, for the HMO and the PPO, we are recommending that we double our contributions. So for the employee only, we will be jumping from $30 a monthly, and this is on a 12-month plan, to $60. Employee plus one child goes from $65 to $125. Employee with two or more children goes from $110 to $210. And then on top of that, we would add the spouse. The spouse cost goes from $125, doubling it to $250. So if you are an employee with a spouse, you would pay the $60 plus the $250 per month. Again, this is on a 12-month plan. So we're being paid on 11 months, so it'll be slightly more per month. The dual coverage is for where teachers or employees where both husband and wife are employed by the school district. They are currently paying $30 a month, and they will be jumping to $60. And each one of them pays. This does by doing it this way, they do not have to add the spouse, which was what the $250. So they are just paying for themselves individually for dual coverage. And by the way, they also have a coordination of benefits so that they don't have co-pays or deductibles on the medications. The dual coverage for family, both spouses have to pay the family rate for the coordination of benefits, and their children are covered. Now, what we have with the Kaiser premiums, there will be no change. What we wanted to do is make sure that we provided a safety net for those who felt they could not absorb those increased costs. So for the Kaiser, all the monthly contributions will stay the same. For the employee plus one, employee plus two, spouses, and the dual coverage plans. The other changes that will be happening is the threshold for spouses. Previously, when we started this program or started the contributions, if a spouse could get insurance for $250 or less per month from their employer, they would have to move to that insurance. We are now increasing that to $400. So if your spouse can get health insurance from their employer for less than $400 a month, they must go on that plan as a primary. They can remain on the CVUSD plan as secondary coverage only, and then you would have to pay the $250 a month contribution for the spouse. Or they would go on to their plan, and that would be their only coverage, and then you would not have to pay for the spouse. We've also reduced the number of chiropractic and acupuncture visits from 55 to 24 per calendar year. And this is trying to bring our plan more into the industry standard, which I believe is 20 visits a year. So those are the changes to our plan.
One of the things that we considered in all of this, and we spent a lot of time considering this and looking at different ways to manage the costs. is spouses were using a great deal of our insurance, and so we really wanted to focus on making sure that that spouses, or excuse me, that employees were being covered, and that spouses were paying more because they were such a large amount of money out of our healthcare fund.